Question 1. What is the most important action when a nurse suspects a patient is experiencing a stroke? A. Call for immediate assistance and begin CPR. B. Administer oxygen and wait for medical orders. C. Perform a neurological assessment and notify the healthcare provider. D. Document the symptoms and continue to monitor the patient. Answer. C. Perform a neurological assessment and notify the healthcare provider. Rationale. When a stroke is suspected, a rapid neurological assessment is crucial to assess the severity and provide accurate information for timely intervention. Calling for assistance is important, but an assessment must precede other actions. Question 2. What is the first step the nurse should take when a patient is experiencing an anaphylactic reaction? A. Administer epinephrine immediately. B. Assess the patient's airway, breathing, and circulation, ABCs. C. Notify the healthcare provider of the reaction. D. Administer antihistamines and monitor the response. Answer. B. Assess the patient's airway, breathing, and circulation, ABCs. Rationale. The priority in anaphylaxis is to assess and secure the ABCs to ensure the patient is not at risk of airway obstruction or respiratory failure. Epinephrine is important but should be administered after ABC assessment. Question 3. When a nurse identifies potential medication error, what should be the nurse's immediate action? A. Document the error and inform the patient. B. Report the error to the healthcare provider and supervisor. C. Administer the correct medication and document the situation. D. Ignore the error if the patient is not showing immediate symptoms. Answer. B. Report the error to the healthcare provider and supervisor. Rationale. Medication errors must be reported immediately to ensure the patient receives appropriate care and prevent harm. Ignoring or correcting the error without reporting it violates protocols. Question 4. How should a nurse manage a situation where a patient expresses fear about an upcoming surgery? A. Reassure the patient that everything will be fine. B. Document the patient's fear and proceed with care as usual. C. Listen to the patient's concerns and provide information to reduce anxiety. D. Ignore the patient's fear to focus on medical tasks. Answer. C. Listen to the patient's concerns and provide information to reduce anxiety. Rationale. The nurse should actively listen and provide clear, factual information to help alleviate the patient's fear. Ignoring or dismissing the concern can worsen the patient's anxiety and impact their cooperation. Question 5. What is the most critical action when caring for a patient post-operatively who is demonstrating signs of hemorrhaging? A. Administer IV fluids to maintain blood pressure. B. Apply pressure to the wound and notify the healthcare provider. C. Monitor the patient's vitals and administer pain relief. D. Document the findings and wait for further orders. Answer. B. Apply pressure to the wound and notify the healthcare provider. Rationale. The nurse must first apply pressure to control bleeding and notify the healthcare provider immediately for further intervention. Administering fluids is important but secondary to stopping the hemorrhage. Question 6. In a case of a patient with chest pain, what should the nurse do first? A. Administer pain medication as prescribed. B. Perform an ECG and notify the healthcare provider. C. Assess the patient's history and document the pain. D. Prepare the patient for a chest X-ray. Answer. B. Perform an ECG and notify the healthcare provider. Rationale. Chest pain can indicate serious conditions, such as myocardial infarction. The nurse should first perform an ECG to assess for cardiac abnormalities and notify the healthcare provider immediately. Question 7. How should a nurse address a situation where a patient refuses to take prescribed medication due to fear of side effects? A. Ignore the patient's fear and administer the medication. B. Educate the patient about the benefits and risks of the medication. C. Notify the healthcare provider of the patient's refusal. D. Ask the healthcare provider to change the medication regimen. Answer: B. Educate the patient about the benefits and risks of the medication. Rationale: the nurse should provide education to help the patient understand the benefits and potential side effects, addressing any concerns. This ensures the patient is informed and can make a decision based on accurate information. Question 8. What is the nurse's priority action when a patient with diabetes mellitus experiences a hypoglycemic episode? A. Administer insulin to correct the blood sugar. B. Offer the patient a source of fast-acting carbohydrate. C. Monitor the patient's blood glucose levels. D. Prepare for emergency transport to the hospital. Answer: B. Offer the patient a source of fast-acting carbohydrate. Rationale: the first priority in a hypoglycemic episode is to provide a fast-acting carbohydrate to raise blood sugar levels quickly. Administering insulin is inappropriate during hypoglycemia. Question 9. How should a nurse handle a situation where a patient is experiencing a panic attack? A. Reassure the patient and encourage them to relax. B. Administer anti-anxiety medications immediately. C. Focus on grounding techniques and offer emotional support. D. Ask the patient to leave the hospital for a break. Answer: C. Focus on grounding techniques and offer emotional support. Rationale: during a panic attack, grounding techniques, for example, breathing exercises, and emotional support are essential to help the patient regain control and reduce anxiety. Medication may be used later, but is not the immediate solution. Question 10. In a situation where a patient expresses suicidal thoughts, what is the nurse's most appropriate action? A. Encourage the patient to keep their thoughts to themselves. B. Document the patient's statements and inform the healthcare provider immediately. C. Dismiss the patient's feelings and encourage them to focus on positive thoughts. D. Ignore the statement and continue with routine care. Answer: B. Document the patient's statements and inform the healthcare provider immediately. Rationale: suicidal ideation is a serious concern. The nurse must immediately document the patient's statements and inform the healthcare provider to ensure the patient receives appropriate intervention and safety measures. Question 11. How should a nurse handle a situation where a patient is demonstrating signs of a drug overdose? A. Administer an antidote as per the healthcare provider's instructions. B. Wait for the healthcare provider to arrive before taking action. C. Document the symptoms and monitor the patient. D. Immediately contact poison control and follow their guidance. Answer: A. Administer an antidote as per the healthcare provider's instructions. Rationale: if a drug overdose is suspected and an antidote is available, the nurse should administer it immediately according to provider's instructions. Waiting for help can lead to further complications. Question 12. What is the nurse's primary responsibility when a patient is admitted with a severe allergic reaction to an unknown substance? A. Administer antihistamines immediately. B. Perform a thorough assessment to identify the allergen. C. Initiate emergency care and notify the healthcare provider. D. Obtain the patient's family history of allergies. Answer: C. Initiate emergency care and notify the healthcare provider. Rationale: the nurse should immediately initiate emergency care, for example, oxygen, epinephrine, and notify the healthcare provider to prevent the reaction from worsening. Identifying the allergen is secondary to stabilizing the patient. Question 13. When should a nurse perform a focus assessment in a postoperative patient? A. Only if the patient shows signs of distress. B. As part of routine postoperative care. C. Before administering any medication. D. Immediately after addressing change. Answer: B. As part of routine postoperative care. Rationale: a focus assessment should be part of routine postoperative care to monitor for complications such as bleeding, infection, or pain. Waiting for signs of distress could delay intervention. Question 14. What is the nurse's role in preventing medication errors during a patient's admission to the hospital? A. Administer medications based on the patient's current prescriptions. B. Review the patient's medical history and current medications, then verify with the healthcare provider. C. Rely on the pharmacy to verify the medications. D. Discontinue any medications the patient was previously taking. Answer. B. Review the patient's medical history and current medications, then verify with the healthcare provider. Rationale. The nurse must review the patient's medication history and verify any discrepancies or concerns with the healthcare provider to prevent medication errors. Simply relying on pharmacy or discontinuing medications may lead to complications. Question 15. How should a nurse handle a situation where a patient is refusing to participate in rehabilitation therapy after stroke? A. Document the refusal and discontinue any further interventions. B. Inform the healthcare provider and offer alternative therapies. C. Insist the patient participate to avoid complications. D. Educate the patient on the benefits and risks of rehabilitation. Answer. D. Educate the patient on the benefits and risks of rehabilitation. Rationale. The nurse should educate the patient about the benefits of rehabilitation to help them make an informed decision. Forcing participation or discontinuing care without discussing it with the provider is not ethical or effective. Question 16. How should a nurse handle a situation where a patient is experiencing an acute asthma attack in ER? A. Administer a bronchodilator and assess the patient's respiratory status. B. Wait for the physician to arrive before taking any action. C. Reassure the patient and encourage them to breathe deeply. D. Perform a chest X-ray and monitor the patient's vital signs. Answer. A. Administer a bronchodilator and assess the patient's respiratory status. Rationale. The nurse should immediately administer a bronchodilator to relieve bronchospasm and assess the patient's respiratory status. Waiting for the physician or doing unnecessary tests could worsen condition. Question 17. What is the nurse's priority when caring for a patient who is receiving a blood transfusion and begins to show signs of transfusion reaction? A. Increase the flow rate of the transfusion to flush the system. B. Stop the transfusion immediately and notify the healthcare provider. C. Continue the transfusion and monitor closely for any changes. D. Administer antihistamines to counteract the reaction. Answer. B. Stop the transfusion immediately and notify the healthcare provider. Rationale. The nurse must stop the transfusion immediately to prevent further harm and notify the healthcare provider for further assessment and intervention. Continuing the transfusion can lead to severe complications. Question 18. When caring for a patient with a mental health condition who is displaying aggressive behavior, what is the most effective strategy for the nurse? A. Use physical restraints to prevent harm. B. Remain calm, set clear boundaries, and provide a safe environment. C. Leave the patient alone to cool down. D. Encourage the patient to express their anger verbally. Answer. B. Remain calm, set clear boundaries, and provide a safe environment. Rationale. The nurse should maintain a calm demeanor, establish clear boundaries, and create a safe space for the patient. Physical restraints should be a last resort, and leaving the patient alone may increase anxiety. Question 19. What is the nurse's first priority when a patient in the ICU is diagnosed with septic shock? A. Administer fluids to restore blood pressure. B. Administer antibiotics to treat the infection. C. Monitor the patient's vital signs and oxygen levels. D. Obtain a urine sample for culture. Answer. A. Administer fluids to restore blood pressure. Rationale. In septic shock, the priority is to restore circulatory volume with IV fluids to support the patient's blood pressure. While antibiotics and monitoring are important, fluid resuscitation should be the first step. Question 20. How should a nurse address a patient's concerns about potential side effects of a prescribed medication? A. Reassure the patient that side effects are rare and they should not worry. B. Provide a detailed explanation of the medication's potential side effects and benefits. C. Suggest the patient stop taking the medication if they are worried. D. Ignore the patient concerns and administer the medication. Answer. B. Provide a detailed explanation of the medication's potential side effects and benefits. Rationale. The nurse should provide clear, factual information about the medication's side effects and benefits to help the patient make an informed decision. Dismissing or avoiding the patient's concerns can lead to noncompliance. Question 21. What is the most appropriate action for a nurse when a patient experiences a sudden drop in blood pressure during a transfusion? A. Stop the transfusion and administer fluids. B. Increase the transfusion rate and monitor the patient. C. Reassure the patient and continue with the transfusion. D. Notify the healthcare provider and discontinue the transfusion. Answer. A. Stop the transfusion and administer fluids. Rationale. A sudden drop in blood pressure during a transfusion may indicate a reaction. The nurse should stop the transfusion immediately and administer fluids to support circulation. Notification to the healthcare provider follows. Question 22. How should a nurse handle a situation where a patient refuses a life-saving treatment due to cultural or religious beliefs? A. Respect the patient's autonomy and document the refusal. B. Persuade the patient to accept treatment for their safety. C. Ignore the patient's decision and proceed with treatment. D. Notify the healthcare provider and administer treatment without the patient's consent. Answer. A. Respect the patient's autonomy and document the refusal. Rationale. Patient autonomy must be respected, especially in matters of life-saving treatment. Documenting the refusal and notifying the healthcare provider ensures that the decision is well documented, and further discussions can be held. Question 23. What is the nurse's priority when caring for a patient after a myocardial infarction? MI? A. Encourage the patient to resume physical activity immediately. B. Assess the patient's vital signs and oxygenation levels. C. Offer reassurance and provide pain relief. D. Administer prescribed medications and monitor for side effects. Answer. B. Assess the patient's vital signs and oxygenation levels. Rationale. In the immediate post-MI phase, the priority is to assess vital signs and oxygenation levels to monitor for complications like arrhythmias or respiratory distress. Pain relief and medication are important, but secondary to immediate assessment. Question 24. How should a nurse respond if a patient who is receiving opioid therapy asks for an increased dose to manage pain? A. Increase the doses requested and document the change. B. Educate the patient on the risks of opioid overuse and consult with a healthcare provider. C. Withhold pain medication and explain the risks of dependence. D. Administer the increased dose without further discussion. Answer. B. Educate the patient on the risks of opioid overuse and consult with a healthcare provider. Rationale. The nurse should educate the patient about the risks of opioid overuse and consult with a healthcare provider to adjust the dosage appropriately. Simply increasing the dose without consultation can lead to dangerous outcomes. Question 25. What is the most effective way to prevent hospital-acquired infections in a surgical patient? A. Administer antibiotics to all surgical patients prophylactically. B. Ensure strict hand hygiene and follow sterile techniques during the procedure. C. Use antiseptics on the patient's skin before surgery. D. Encourage patients to maintain hydration before surgery. Answer. B. Ensure strict hand hygiene and follow sterile techniques during the procedure. Rationale. The most effective way to prevent hospital-acquired infections is by ensuring strict hand hygiene and maintaining sterile techniques during surgery. Antibiotics and antiseptics are helpful, but should not replace proper infection control practices. Question 26. How should a nurse prioritize care for patients when a unit is understaffed? A. Provide care based on patient arrival time. B. Prioritize care based on patient acuity and needs. C. Focus on the most stable patients first. D. Delegate all tasks to other healthcare team members. Answer. B. Prioritize care based on patient acuity and needs. Rationale. In an understaffed situation, patients who are more critically ill or unstable should be prioritized over those who are more stable. Delegation is important, but prioritization based on acuity is the key. Question 27. What should a nurse do when a patient exhibits signs of delirium following surgery? A. Increase the patient's sedation level. B. Provide a quiet and well-lit environment and assess for underlying causes. C. Ignore the symptoms, assuming they are temporary. D. Administer antipsychotic medications as prescribed. Answer. B. Provide a quiet and well-lit environment and assess for underlying causes. Rationale. Delirium can be caused by several factors, including medication, dehydration, or infections. A quiet environment and careful assessment can help reduce delirium. Increasing sedation or ignoring symptoms may worsen the condition. Question 28. When a nurse suspects that a patient may be experiencing a pulmonary embolism, what is the nurse's first priority? A. Administer oxygen and notify the healthcare provider. B. Assess the patient's pain level and administer analgesics. C. Perform a focused respiratory assessment and order a chest X-ray. D. Encourage the patient to cough and deep breathe to improve oxygenation. Answer. A. Administer oxygen and notify the healthcare provider. Rationale. Pulmonary embolism is a medical emergency. Administering oxygen and notifying a healthcare provider immediately are essential to prevent further complications. Other actions are secondary to stabilizing the patient's oxygen levels. Question 29. In what situation is it appropriate for a nurse to make an ethical decision on behalf of a patient without explicit consent? A. When the patient is mentally competent but refuses necessary treatment. B. When the patient is unconscious and the decision is life-saving. C. When the patient's family consents on their behalf. D. When the patient's refusal of treatment is expected to cause harm to others. Answer. B. When the patient is unconscious and the decision is life-saving. Rationale. In life-threatening situations where the patient is unconscious, the nurse can make decisions based on the ethical principle of beneficence, prioritizing the patient's well-being. Explicit consent is not possible in this scenario. Question 30. What is the nurse's most appropriate action when a patient reports having chest pain and shortness of breath? A. Administer oxygen and prepare for a chest X-ray. B. Perform an assessment and immediately notify the healthcare provider. C. Reassure the patient that the symptoms are likely not serious. D. Administer pain medication and monitor the patient's vitals. Answer. B. Perform an assessment and immediately notify the healthcare provider. Rationale. Chest pain and shortness of breath can be symptoms of a serious condition such as a myocardial infarction or pulmonary embolism. An immediate assessment and prompt notification to the healthcare provider are essential for appropriate intervention. Question 31. What is the nurse's priority when caring for a postoperative patient who develops signs of infection at the incision site? A. Administer antibiotics as prescribed. B. Monitor vital signs and document the infection. C. Notify the healthcare provider and prepare for wound cultures. D. Remove the dressing and clean the wound thoroughly. Answer. C. Notify the healthcare provider and prepare for wound cultures. Rationale. Signs of infection require prompt evaluation by the healthcare provider, who may order wound cultures. Administering antibiotics or cleaning the wound may follow based on provider's orders. Question 32. When caring for a patient with a newly inserted central venous catheter, CVC, what is the nurse's priority to prevent infection? A. Ensure the catheter is flushed daily. B. Verify proper placement through imaging. C. Maintain sterile technique during dressing changes. D. Educate the patient on signs of infection. Answer. C. Maintain sterile technique during dressing changes. Rationale. Maintaining sterile technique during dressing changes is essential to prevent infection in a patient with a central venous catheter. Flushing and imaging are also important, but secondary to infection prevention. Question 33. How should a nurse respond when a patient who is receiving chemotherapy expresses concerns about hair loss? A. Reassure the patient that hair loss is temporary and not serious. B. Offer resources for managing side effects and provide emotional support. C. Tell the patient that hair loss is a necessary part of treatment. D. Ignore the concerns and focus on the medical treatment plan. Answer. B. Offer resources for managing side effects and provide emotional support. Rationale. Offering support and resources for managing side effects, including hair loss, is an essential part of patient care. Addressing emotional concerns improves patient satisfaction and coping. Question 34. What is the most appropriate nursing intervention for a patient exhibiting signs of hypovolemic shock after traumatic injury? A. Administer fluids and blood products as prescribed. B. Apply pressure to the wound and elevate the legs. C. Administer oxygen and monitor the patient's vital signs. D. Perform a neurological assessment and document the findings. Answer. A. Administer fluids and blood products as prescribed. Rationale. In hypovolemic shock, the primary intervention is fluid resuscitation to restore blood volume. Oxygen and wound management are also important but secondary to fluid and blood administration. Question 35. What is the nurse's role when caring for a patient who is being admitted for hospice care? A. To provide emotional support and ensure comfort for the patient and family. B. To administer all medications as prescribed and provide end-of-life care. C. To educate the family about the patient's prognosis and treatment plan. D. To focus solely on symptom management and reduce patient discomfort. Answer. A. To provide emotional support and ensure comfort for the patient and family. Rationale. The nurse's primary role in hospice care is to ensure the comfort and emotional well-being of both the patient and their family, while also managing symptoms. Education and medication are secondary to providing holistic care. Question 36. How should a nurse respond if a patient begins to display signs of a panic attack during a procedure? A. Calmly reassure the patient and ask them to breathe deeply. B. Encourage the patient to focus on procedure and ignore the anxiety. C. Quickly administer anti-anxiety medication to calm the patient. D. Tell the patient that their anxiety is irrational and proceed with the procedure. Answer. A. Calmly reassure the patient and ask them to breathe deeply. Rationale. During a panic attack, reassurance and deep breathing exercises are crucial to help the patient regain control. Medication should be used if necessary, but reassurance should be the immediate response. Question 37. What is the most important action when a nurse notices that a patient's surgical site has become red and swollen? A. Document the findings and wait for the healthcare provider's assessment. B. Reassure the patient that these are normal post-surgical symptoms. C. Notify the healthcare provider and prepare for possible infection. D. Apply a warm compress to the surgical site to relieve swelling. Answer. C. Notify the healthcare provider and prepare for possible infection. Rationale. Redness and swelling at a surgical site can indicate infection. The nurse should notify the healthcare provider promptly and prepare for interventions such as wound cultures and antibiotics. Question 38. What is the nurse's priority when caring for a patient with severe acute pancreatitis? A. Provide pain relief and administer prescribed medications. B. Monitor vital signs and assess for signs of shock. C. Educate the patient on lifestyle changes to prevent future episodes. D. Offer emotional support to the patient and family. Answer. B. Monitor vital signs and assess for signs of shock. Rationale: acute pancreatitis can lead to severe complications such as shock. The nurse's priority is to monitor vital signs closely and assess for signs of hemodynamic instability. Question 39. How should a nurse respond if a patient is becoming increasingly agitated and violent during a hospital stay? A. Attempt to physically restrain the patient immediately. B. Maintain a calm demeanor, set boundaries, and call for additional support if needed. C. Leave the patient alone to prevent escalation. D. Ignore the behavior and focus on other tasks. Answer: B. Maintain a calm demeanor, set boundaries, and call for additional support if needed. Rationale: the nurse should remain calm, set clear boundaries, and call for support to ensure safety. Physical restraint should be a last resort, and leaving the patient alone may increase agitation. Question 40. What is the nurse's responsibility when caring for a patient who expresses a wish to end their life due to a chronic illness? A. Respect the patient's wishes and provide comfort care. B. Document the statement and inform the healthcare provider immediately. C. Ignore the statement, assuming the patient is just expressing frustration. D. Encourage the patient to seek counseling for emotional support. Answer: B. Document the statement and inform the healthcare provider immediately. Rationale: suicide ideation is a serious matter. The nurse must document the statement and inform the healthcare provider to ensure the patient receives the appropriate mental health support and intervention.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.